Starting from when they're really little, we want to educate the parents. We want the parents to come in at 1 year old, and that's not necessarily for the kid. Sometimes we do have patients with cavities at 15 months old, and we feel awful that that has happened at that point, but it's really to educate the parents to try to prevent from getting decay, from getting cavities. And part of that is diet and nutrition. When they're little, we don't want them going to bed with milk or juice in the bottle. Some parents will say, well, I just add a little bit of juice and a lot of water. Juice is juice. It still has sugar in it. We prefer just plain old water at a certain point. If you're going to give your child milk before they go to bed, we prefer that they have the milk, brush their teeth, and then put them to bed. If they really need a bottle, is it nutrition, meaning they need the milk because they need that nutrition, or is it that they just need the comfort? If they need a bottle just for comfort, we ask them to try just plain water, and then the milk can come again before the brushing of the teeth, and then just a bottle with water in the crib if they're thirsty or they need that sucking, that non-nutritive sucking, comforting that they need. As they get a little bit older, then diet and brushing, we encourage while the child is sitting in a high chair still at that point, or a booster chair, that you brush after every solid food feeding. So even if a baby is 8 or 9 months old, you want to get those teeth clean before they get out of the high chair. So you're not chasing them around trying to get, the teeth clean, but just keep the toothbrushes at the kitchen sink. Take the toothbrushes out with the spoon and the food and the cup, and just brush their teeth really quickly. They only have like 6 or 8 teeth. Just brush them, get them out of the chair, and then send them on their way. If the kids are getting juice or chocolate milk or milk with a meal, we ask you to keep that juice or chocolate milk at the table when the child is done. So if they're done with the meal, they're done with the juice and the chocolate milk and the milk, and leave it at the table, and they could go and play. We don't want this sip, this drinking and sipping, this take a drink, go run and play, take a drink, go and run and play, because it's the frequency that bathing the teeth with that sugar that whole time, and then your mouth is producing an acid to break down that sugar. That's what really causes decay. So parents at 2 or 3, oh, they never get candy. I don't understand why they're getting cavities. Because chocolate milk has chocolate in it, but regular milk has natural sugar. Juice, of course, has unnecessarily calories, but also sugar in it as well. So it's important that after they're done at the table, they just get water. So anything in between meals should just be plain water. So parents just think candy, but what about carbs? So we have kids who are big carb eaters. They only eat pasta. That's all they eat. They eat mac and cheese, buttered noodles, lots of bread, crackers, goldfish. Oh my God, goldfish is so popular, right? Even when my son was a kid, every snack was like, I have a bag of goldfish, or Cheez-Its, or some kind of cracker, right? Or those puffs that just melt in your mouth, where they just melt and they just stick to the teeth because a carb turns into a sugar. Those kids are not brushing their teeth after every meal, because at 5 or 6 years old, it's almost impossible to get a brushing after lunch. So we want at least 2 brushings a day, and to try to stay away from some of those carbs as well as the candy.